Well, welcome everyone. We are so excited that you are here tonight to be able to learn more about our allied health programs through Workforce Solutions. We want you to know that if you are just getting starting or just getting started in your career, or if you want to enhance your career, or if you want to completely change your career, this is a great place to get started. So we are more than excited to share about these programs with you. My goal in sharing this information with you tonight is so that you can make the best decision possible. We want you to have the information that you need to make the best decision. So with that in mind, what we're going to talk about tonight is financial aid. We're going to talk through the different options that you have available, and then we are literally going to go program by program and hopefully answer any questions that you would have, and just really kind of cover it at a high level, some about the job itself and then some about our program. And then we will take questions at the end. So the very first thing I'd like to just talk about is our financial aid. And the reason I like to bring that up first is one of the first questions we get is, how in the world would I even pay for this? Yes, I want to change my career. Yes, I want to start out, but I really don't have the money to do so. So I like to just share the resources that we have available just from the very, very beginning to calm any fears that you might have. Because we have some amazing financial aid options. I am actually going to stop my screen share at this point because I'm going to take you to the live website so that you can see exactly what I am going to do online so you can see it for yourself. So we are actually going to go to workforcesolutions.com, and I'm just going to actually type that in. And this is the page that you would come to. On this page, I'm going to highlight just a couple of things specifically around funding. We have a whole bunch of different things with regards to funding, but I'm going to highlight a few of them. The first one is Fast Forward. This is a fantastic program. Basically, the state of Virginia said about 3 years ago that there's a huge skills gap between the jobs that we have out there and the people that we need to fill them. So they said, we are going to come in and we're going to cover 2/3 of a cost of a class for a student, which makes the class incredibly affordable for a lot of students. And so for an average class, all you will ever pay is that first third of the cost of the class. And the state of Virginia will pay back the community college once you have completed the class and sat for the credential. As long as you do those two things, that's all you'll ever pay. If you decide to, for whatever reason, not complete the class, you are responsible for a second third. So we're going to talk a little bit more about an example of that as we get into the program, but as we get into each specific program. But just know that 2/3 of the cost of a class can be completely covered by a grant that you will never ever have to repay. So that's basically Fast Forward in a nutshell. If you go to this website, workforcesolutions.com, and you click on the Fast Forward funding option, this is the page that's going to come up. There's a little video here, which I'm not going to play right now, but at least you know where it's at, that explains it a little bit better than I probably did. But I didn't want to take the chance tonight with the audio to make sure that everyone could hear it. So if you have a chance, please go back and check that out. So that's basically Fast Forward in a nutshell. The other thing that I wanted to talk about is Fantic. Now, with Fast Forward, the only requirement is that you are a resident of Virginia. You do have to complete a domicile form just saying that you have been here for a year and plan to stay here. That's really all you have to do. So your finances do not matter. It's just really, are you a resident of Virginia, and are you interested in taking this class, and are you willing to say that you will complete it and sit for the credential? Now, with regards to Fantic, if you have financial need, saying like, wow, this class is still too much for me, I still don't think that I can afford it, there is another option called Fantic. And Fantic is based basically on your most recent tax transcript. So if you click on that button, taking you to Fantic, this will tell you a little bit more about it. There are more qualifications with regards to this. Like I said, you do have to meet all of the qualifications of Fast Forward first, but then you also need to provide verification of your photo ID. You need to get your tax transcript. We do need a copy of that. And basically this page explains everything that you would need to have and need to do. So I really encourage you to read through this information. One of the most important things to see if you qualify for Fantic is on this page, and it's the maximum income guidelines. So based on your tax transcript, we look at the number of people in your household, and then we look at your income levels. Tier 2 is basically for Frederick, Page, Rappahannock, all of these counties. Tier 3 is for Clark, Fauquier, Fairfax, and these counties. So basically you just go up to the chart, you look at how many people are in your household, and if you are under these levels, then you could qualify for Fantic. We would just need the paperwork to prove that. In that case, and if you are eligible for Fantic, Fantic will cover 90% of that 1/3. So you have your full price, you have your fast forward price, which is down to 1/3, and then Fantic can cover 90%. So you're only left with 10% of the cost of that class. I'm going to give you a specific example with our nurse aide program. So for example, full price is $1,140. If you have been in Virginia and you would qualify for Fast Forward, you could only pay $380. That is 1/3 of the cost. If you still say, hey, I have financial need, and you could qualify for Fantic, that class now becomes $38. And $38 is all you will ever pay as long as you complete the class and sit for the credential. Fantic operates the same way. If you don't complete the class, you are still responsible for a second third of $380. So honestly, these are some fantastic grant opportunities that you don't ever have to pay back. It's a great opportunity to get some training, to either get started or to enhance or to completely change a career. This is a great way to be able to have some funding options to be able to do it. So at $38 for someone who has financial need, what an awesome opportunity. So we'll talk through some other examples as we go on, but in a nutshell, that's some of our funding options. Now, if for some reason you are still not able to come up with those funds, say you did not qualify for Fantic, but you still have some need, if a program is over $1,000, you are able to apply for a Sallie Mae loan. Also, not all of our programs are considered fast forward and are eligible for those funds. So for example, right now our farm tech and our dental assisting programs don't fall into those categories, and you don't have the funds for that full price, you are able to apply for a Sallie Mae loan right here. And you actually just go to our website and fill that out, and it submits automatically through the site. So that's everything about financial aid at this point. If you have any questions about that, I'll give you our numbers at the very end to be able to contact us to talk through your specific situations. But I did want to show you where all that information is listed. So in case you want to go through and read all of that, it's all right there. The next thing I want to show you really quickly is where our course catalog is listed. So again, if you just go to lfccworkforce.com, and I'm just going to type that in. You'll come to our main page. Under that is our courses and programs. If you scroll down to course catalog, under there is fall 2020. And these are the classes that I'm going to be talking about tonight. So if you click on that, it opens up our catalog. Hopefully you've gotten one in the mail and you are ready to go. But if not, this is where it's located. There's some really cool features about this online version. And I'm going to flip over to page 13 because that's specifically where the healthcare classes are. If you go to this catalog and you roll your mouse over these different areas, it will highlight it, and then you can actually click on it and it'll take you directly to a place where you can learn more and register. So it's an easy way to get to some of our programs to get more information. But basically, as we go through the presentation tonight, I'm going to be going in this order because I have my catalog here, and I'm basically going to start from the very beginning and work my way through. So if you have a catalog present, awesome. If you want to open up this page and follow along, that's great too. Then you can also see some of like what I was talking about here at the bottom. It's probably kind of tiny on your screen. Let me see if I can zoom in just a little bit. No. But it'll give you like the full price option and the fast forward price. So that way you can see those prices and those different things as we go along as well. So at this point, I'm going to stop sharing the website and I am going to go back to our PowerPoint. But just know I am using the catalog, so if I'm looking down, that's what I'm looking at. So we talked about the catalog and where things are located. One of the other big questions that I figured we would get is, are there going to be any jobs at the end of this? And to be honest, my role within Workforce Solutions, oh, and I'm Anna Teeter, by the way, and I also have my co-host Janet Mays with us tonight. I program all of the classes, which means I do the research behind what do we offer, how do we offer it, what programs do we really need to offer, and then I get to hire fantastic instructors to teach those courses. And Janet is one of those wonderful instructors who she is the Allied Health Program Lead for specifically medical assisting and phlebotomy. So she is going to be talking about that tonight. But back to my original thought, I knew that people would have questions of, are there jobs out there? With the current climate and with everything going on. So I pulled some data last week. I wanted to see for myself. So I pulled this as of June 30th, again, last week, and I pulled it just for the past 30 days. Typically when I look at data, I pull it for like the last 6 months because sometimes there can be ups and downs and fluctuations. But with everything that has been going on throughout our nation and throughout our region, I knew that I didn't want to pull that from the last 6 months because things have been so strange throughout everything that has happened. So I pulled just the last 30 days. So I just wanted to share with you briefly what I came up with. This box right here talks about, or the data that I pulled was from just our Lord Fairfax region, our service region. So that includes Frederick, Clark, Shenandoah, Winchester City, Warren, Fauquier, and Page within that region. So these jobs were all listed from within that region. So as you can see, nursing assistants comes in at the highest with 99 total ads. This is actually, this data is actually much higher and was surprising to me than I thought it was going to be in terms of what's out there right now. Typically these numbers are a lot higher, but again, I just pulled them for 30 days just to get a sense of what's been happening. You can see medical secretaries and our administrative assistants comes in next, and you can go on down through the list. This category over here includes all of the LFCC area as well as some surrounding counties. So typically I look for about a radius of about an hour's drive just to get a sense of, hey, if you're in Winchester and you're willing to travel to Loudoun, what does that look like? If you're willing to travel to Hagerstown, which is only about a 45 to hour drive from Winchester, I wanted to include all of those areas as well, because that sometimes gives me a better picture, depending upon where you're located. If you're willing to travel, what's available. And obviously there are more jobs potentially in Loudoun County than there are sometimes in Winchester. So I like to just get a sense of that. Again, nursing assistants came in the highest. And as you can see, the categories are pretty similar, but these numbers really are pretty high. But I just wanted to show you that hopefully as time goes on and as the market continues to pick up, these numbers will continue to increase. But I just wanted to put your mind at ease a little bit to say there are jobs out there. There are people still hiring. And again, hopefully this will continue to get stronger as time goes on and the situation improves. But that's where we're at currently. So with that, I'm going to jump right into our nurse aid program. Again, I'm following along in the catalog in case you just jumped on. Our nurse aid program, just so that you know, both the nurse aid program and the medication aid program are currently on pause as far as registrations. And the reason these two programs is simply because clinicals are a required part of the program. And at this point, we are not able to get into the clinical sites to complete that. So at this point, we do have to pause that, unfortunately. We are doing everything that we possibly can. We're in constant contact with our clinical sites, but at this point, they are on pause. Probably until at least October and or whenever those sites open up for us. So we are keeping an eye on that. If you are listening to this at a later time, please just keep checking our website. That has the most up-to-date information as far as when classes will open. I do want to go ahead and cover this information though, because if you are listening to it at a later time and or if you're interested in this program, then you'll still have the information to make a decision when it is available. So the nurse aid program as a nurse aid, it is an entry-level position within the healthcare industry, specifically under the supervision of an LPN or an RN. This is a great way to get started in the healthcare field. Many RNs, LPNs, BSNs will typically start out as CNAs. They want to get the experience, and it is a great place to get started. There are a couple of registration requirements for this program. You do need to complete a work keys assessment. There is a background check, physical, drug screen, and a BLS CPR class that is all required before the class starts. And again, that's simply because the clinicals are included in the class. So we need to make sure that you are going to be prepared and ready to go to that clinical site. So that does have to be completed ahead of time. So be aware that you can't just come in and register for the class and go to the class that next day. Typically, most of this needs to be done 4 to 6 weeks in advance. So you need to plan on that. At the end, you are eligible to sit for the exam to become a certified nursing assistant. This is under the jurisdiction of the Virginia Board of Nursing. So there's a lot more information on that website as well if you want to learn more about just what a certified nursing assistant is. But typically, CNAs are often employed within assisted living facilities, home health agencies, and some areas of the hospital. A lot of times people will get a CNA and a medication aide, or a little bit confused, as well as a medical assistant. A nurse aide's duties will typically include bathing, obtaining vital signs, feeding, incontinence care, monitoring intake and output. So you're doing a lot of the daily tasks for a patient. At this point, we did cover sort of the price for that. Again, just be aware that there are requirements ahead of time to complete if that's something that you're interested in. Now, if you have already done a nurse aid program, then you are eligible to complete a medication aid program. And medication aids safely administer or assist with client administration, medication in specific settings, specifically long-term care facilities and assisted living facilities. It is a great next step. It is a great stack-on credential. Typically, it does pay more if you have that. There's a huge, huge high need for both nurse aides and medication aides within our region, almost constantly. As you saw from the data that I just pulled, you can see that that is the highest level of need at this point, but it is almost constant. So there are all kinds of jobs. And typically in these arenas, if there's a specific place that you want to work, you can usually kind of write your ticket there because they're always looking. It is definitely a challenging position, but it can also be a very rewarding one. And just know some students start out as nurse aides and they continue in that. They love it. And actually Janet is on here and she actually does some of that along with her other duties as a LPN, but she loves it and she enjoys it, and some students that's what they'll get their training in and that's what they'll continue doing, and that is super and fantastic because there is certainly a need. Other students use this as a stepping stone. So if you are specifically interested in being a nurse on a cardiac unit, you can certainly apply to be working in the hospital on a cardiac unit. So just know that there's a lot of ways that this can be utilized, whether it is to gain skills and to get knowledge, and or if you have to work your way up to being a nurse, there is that pathway there available to you as well. Also just know that with this program, the test is not included. It's probably one of the only ones that I have that isn't. And that's just simply because it's so tricky to manage. And so there is that additional fee if you are interested in taking this course and the exam. Next, I'm actually going to turn this over to Janet, and I'm going to have to stop sharing for just a second so I can unmute her so that she can share. Since she is the lead on this program, I wanted her to be able to share the information about both medical assisting and phlebotomy. So Janet?
Welcome. Thank everyone for joining us this evening. It's really nice that you're here and we have this ability to tell you about all of our programs. Since Anna just recently talked about nurse aid, I will add to that it is the opportunity to make a difference in someone's life every single day. So it's definitely a rewarding chosen path. And oftentimes it is the stepping stone. It was certainly my first stepping stone when I took a CNA course as a teenager. I then worked many years as a medical assistant, which is why I feel I do a pretty good job teaching this program, and I'm happy to share this information with you. And eventually I did go on to get my LPN license in nursing. So our medical assistant program, it's very intense. We do meet 3 times a week, Monday, Wednesdays, and Fridays. We have both daytime and evening classes at our Middletown campus. We meet Monday, Wednesday, and every other Saturday at our Fauquier and our Luray campuses. Of course, our full schedule is available on the website so that you can see all the dates and times. It is very important that you have regular, reliable internet access. A personal computer is not required, but access to a computer with internet capability is necessary for completion in this course. We have learned a lot over the last few months, and we continue to learn, but we do know that you will need to be able to access the internet regularly. Medical assistants are primarily employed in doctors' offices, specialty clinics like OBGYN or surgical suites, urgent care centers, or even with insurance companies, filing claims and following up on payment of duties. They have a very wide variety of different fields available to them, such as cardiology, orthopedics, OBGYN again, neurology, oncology, family practice, and many, many others. You can certainly choose to specialize. I was blessed to be a part of a great family practice for about the best part of 20 years. And I learned so many things there that had I chosen, I very easily could have went one of these other routes to cardiology or orthopedics or neurology. You usually enjoy a set schedule with first shift hours with no days or weekends. However, if you work in an urgent care center, you very much could have evening shifts if that works well for you. You may have some weekend shifts, which may suit your schedule if you decide to continue your education along your medical or healthcare pathway. We do have some of these positions now even will allow you to do 12-hour shifts. And that may work for your life to have 3 12-hour shifts and be a full-time employee. Anna, I'm going to ask you to switch to the next slide, please. Some of the things that we will do, we'll do these certainly in our, I call it our classroom clinic, because that's what we're really doing. We're practicing for our real life clinic. So this is our classroom clinic. We draw blood. We do venipunctures. We give shots, administer medications or immunizations. We do work on scheduling appointments. We work on mixing and dispensing medications, of course, under the doctor's order. We practice calling in prescriptions, suture removals. The most important part of our job is taking accurate vital signs, so we spend a lot of time with that. And obtaining the patient's medical history, which I truly believe can be its own art, because sometimes people don't want to share everything with this new person they just met. We spend a lot of time working on these skills to make sure that when you get into the clinic, you may not know every single thing, but the things that you do know, you'll know well, and you'll be prepared to go to work. We do practice our skills on each other in class. You must participate to ensure not only your success, but to complete the course. So you will practice with another partner, and they will then practice on you. Our class is very fast-paced. There is homework assigned weekly. There are assessments throughout the program in quizzes, tests. We are working on some new software in our programs that hopefully will assist us to give some different types of assessments that we haven't had the opportunity before. So again, this is a very busy program. It's usually anywhere from 20 to 22 weeks, depending on whether or not you have the Monday, Wednesday, Friday, or the Monday, Wednesday, Saturday. But it's usually around 22 weeks. It's a full semester, and you do meet 2 to 3 times a week, and it's very busy. So just be aware that you're going to need to dedicate yourself to the program. Phlebotomy technician program, it prepares our students for a career in blood collection, mostly blood collection. It does primarily focus on venipuncture and capillary sticks. So that's your normal venous blood draws, or capillary sticks is blood collection, usually from the fingers. It could be a heel stick in infants. But we also do non-blood collections, such as urine specimens, throat cultures, nasopharyngeal cultures. We do a lot of different types of collections, not just blood. The program is very fast-paced again, 55 hours. When available, we do have an optional 100-hour externship, which allows you an opportunity to take an extra test to get a secondary phlebotomy certification if you so chose. You do not have to or need to necessarily participate in the externship, but it is something that is usually available in most cases. Skills, again, are practiced on each other during class. Participation is mandatory, and I want you to know that it's not a little bit of participation. We have a total of 30 venipuncture sticks done both straight sticks and butterfly sticks, along with 10 capillary sticks at a minimum. So this is, you're definitely signing up to be prepared that you're going to know this is how you're going to learn to be a good phlebotomist, is by practicing your art. It is a great program. Everyone usually seems to just enjoy it. Everyone's nervous at first, but they really, they wind up being almost a team where they work together and lean on each other if someone had to be out and they know they're going to need to make up some sticks, where they just really depend on each other. So it's a fun environment also. And a phlebotomist can work in the doctor's office. They can work in outpatient blood clinics or collection clinics. They could work in the hospital. Their hours can be very flexible. It may meet your needs depending on where you want to be employed. For instance, if a 4 a.m. start of your shift looks good for you, you might be great in the hospital because they want those early morning fasting labs ready when the providers are making rounds at 7 or 8. Again, you could be employed through insurance companies, home health agencies, or even skilled nursing facilities. You might be dispatched out to do venipunctures outside of your normal setting. Our course, I'm sorry, I didn't go over the cost on either of those courses, Anna. I'm going to defer that to you because I don't have my catalog with me. But they are available in our catalog, which Anna showed you where to reach that online as well. And I look forward to hopefully one day meeting some of you guys.
Awesome. Thanks, Janet. You also brought up another point about externships that I do want to mention. At this point, we are have a pause on all externships. So if you are set up to take a class starting in August, please be aware that an externship will not be available to you. If that is something that you are interested in, then you probably you do need to wait for another session. We can't guarantee externships at this point because it is totally based on our clinical sites. And at this point, their staff are so overwhelmed with everything that's going on that they just cannot take on additional students. So once that opens up again, we certainly want to open up that opportunity to students. We believe in it. It's a fantastic way to get some experience. We've had great success with it, but at this point, it's just not an option. So please be aware that for all of our programs at this point, externships are not available. So again, if you want that option, you will have to choose a later section when it does become available again. All right, the next thing that we're going to cover is with regards to our medical scribe program. And basically, a medical scribe works directly alongside of the physician. So sometimes you're seeing them more and more frequently. So if you go to a doctor's appointment and there's someone in the corner just typing away, that's what a scribe is. They're basically just notating everything. So they're following that physician around from room to room. Sometimes they will do duties similar to a medical assistant, that they'll get the room set up. So this is an additional skill for some medical assistants, that they will set up the room, but some are just purely just scribes. You do have to know a lot of medical terminology because you are having to dictate all of that or notate all of that within an electronic medical record. So you really do need to know that terminology. You need to know, you're going to learn how to write SOAP notes. You're going to have to understand the ICD-10 coding, and really your roles and functions as a scribe. So this class does prepare you to sit for an apprentice medical scribe professional certification. Once you complete a certain number of hours, it automatically rolls over to just the apprentice part goes away and just a regular certification. This class is going to be, let me actually jump back. It's going to be mostly hybrid, mostly online this time. Basically, you'll have to come to class for 3 sessions. The first one to get your books and to just get set up. And then 2 more sessions just for role plays and practice and hands-on. Everything else is going to be done online. Since this role is really an online sort of role anyway, you're learning how to hear and type. That's essentially what we're trying to emulate so that you are prepared for that class and for that role. So please be aware that you would only need to come to the Middletown campus 3 times throughout the class. Everything else is completely online. Next is medical terminology. This is a great kickstart class. If you are not really sure what you want to do in the healthcare field, this is a great class to get started with because you're basically learning another language. You're learning how to communicate with physicians and nurses and different people that you're around, different documentation that you're around. So it is a great place to get started. This is a quick class, but it is an intense class in that there's a lot of memorization involved with it. I love all my instructors. This one is absolutely fantastic. It's funny, someone had, I was talking to them about medical terminology and they're like, oh, it's so boring. Not with this class. She will keep you on your toes. It is engaging. It is fun. Students come out of that class knowing that information. So it's not just, hey, I took a class back 5 years ago. No, you know this information. So when something comes across your desk, you know what it is and what it stands for. There are certainly times when you can look up things while you're on the job, just learning things, but it is so much better to understand the language and be prepared. So this is a great class to get started with. It is a required class for the patient service representative class, but truly it's great for anyone. And for anyone that has been looking at different jobs with regards to contact tracing, a lot of times they require that you know medical terminology. This is a great class. A lot of times they don't say what exactly you need, but that just that you know it. And this is a great way to know it. Again, lots of memorization, but she'll make it in a very easy, understandable way. Or she'll present it in that way so that you are well prepared with that information. We are offering 2 different sections this fall. One is going to be at Middletown and the other one is going to be completely online. So if you're not able to make it to Middletown, you are able to join the online class. Yeah, it's just a fantastic class just for anyone getting into a career path. It is not required for other programs simply because other programs are a little bit longer. So like for the medical assistant or for the nurse aide program, it's already included in that. So it is not a separate piece, but for the patient service representative class, it is. So moving right into that, what Janet explained as for medical assistants, they are doing, or they can do, both front end as well as clinical requirements. And it all really depends upon where you get hired at as to what your duties are going to be. So you could be a medical assistant, so to speak, and be at the front desk. That could be primarily your role. In other offices, you may be at the front desk and you may be pulled to the back. In other offices, you may just be doing clinical requirements. So it really just, again, depends on that hiring place. But if you are not interested in blood or any of that, but you're interested in the medical field, this is a great class for that, as well as the Scribe program, because both of those are not clinical roles. You're primarily especially as a patient service representative, you're at the front end. So you are the first person to greet people and the last person to greet them goodbye as they walk out the door. So you really kind of set the tone for them. I will say that there are a ton of different names if you're looking for jobs on the website for this role. So I've listed a whole bunch of them here on the screen. And what I really like to encourage students to do, no matter what your healthcare field program is that you're interested in, is if you go to a search engine like Indeed, for example, type in healthcare or type in medical, and let it pull up everything and then sift through it. If you go in and put in just patient service representative, you're going to get a lot less responses than if you keep it broad. So I encourage you to keep it broad when you're searching, and then sift through, because there might be, sometimes there are new titles that I'm like, wow, I've never heard this one before, and different things will pop up. But as you look at and you click on that and you see what the requirements are, you might find that it could be something that you would be an appropriate candidate for. So I certainly encourage you to research that way. And I certainly do encourage you to look at the job market as well to see what's out there. I also encourage you to go directly to the site at times to see if that posting is still listed and still available. So for example, I'm just using this as an example, but if you go to Indeed and you see that Valley Health has a position, go to the Valley Health website directly to make sure that it's still out there and still available. So again, the patient service representative does a couple of things within the office. Typically, they're scheduling appointments. They do a lot of database management. They greet patients as they come in. They're answering the phones, filing insurance, faxing, processing medical records. So there are a lot of tasks involved, and it is a very busy position typically. This program is 36 hours of classroom training. It is spread out over 12 weeks, so it is just a once a week class. At this point, we are offering it the same way as the medical terminology, in that there's a section going to be at Middletown, and then there is also going to be a section just purely online. For both of those classes, the instructor is the same for both the online version as well as the in-class version. So it's the same instructor either way. Again, medical terminology is required before you take this class, simply because it is a part of the certification exam at the end, and it is required that you know it. And we want you, for all of our classes, to be prepared for two things. One, for the job itself, and two, for the certification exam. We don't ever want to just teach to an exam, and we don't ever just want to prepare you for the field and not for the exam. So we really kind of focus on both of those two areas. At the end of this class, you are prepared to sit for the Certified Medical Administrative Assistant exam, and that is through the NHA. Next is our dental assisting program. It is one of our newer programs that we have to offer, and it has been a fantastic program. This one is not included with Fast Forward, like I had previously mentioned, and that's simply because I don't have a certification to tie to it. So there are certain restrictions that they have put on us to enter a program into Fast Forward, and that is one of them. There has to be a credential, and I simply just don't have one at this point. But it is a fantastic opportunity to get into the dental field, whether you want to just go in as a dental assistant, or you want to continue on as maybe a hygienist or a dentist at some point. They are a valuable team to the dental care community. I also like to explain it similarly to medical assistants, as they work hand on hand with a physician or provider. A dental assistant does the same thing with a dentist. They are their right hand. So they are literally their right hand as they're handing them instruments. They work to set up rooms. They tear down rooms. They sterilize equipment. They both, in this program as well, they both can do clerical and clinical functions. And again, it all depends on where you get hired as to what you may be doing. You may be doing front end or the clinical or both. As a part of this program, though, even though there isn't a specific certification with regards to dental assisting, you will get your BLS CPR certification as well as your radiation health and safety, because almost all employers require you to have those two things. It is a required part of the course, and you will get those certifications. This is also a 160-hour class. Again, your duties could include welcoming patients in, select and set up instruments, equipment, and materials. You could be sterilizing instruments, You're really just assisting the dentist is really what it comes down to, and working alongside of them, as well as patient care. So you could be giving them instructions at the end of the appointment as far as what they need to do as well. You could also be taking x-rays and photos, and we do those all as a part of the class. And I do like to highlight that for the majority of our classes, they are very hands-on. You are super involved, just like Janet had shared many of the things within the medical assisting program. The dental assisting program is in the hygiene clinic, and they are practicing on each other. They do use molds for things, as far as pouring molds. Those kinds of things are not actually necessarily in your mouth, but they do help with cleanings and different things as well. So again, very super hands-on. Next is our pharmacy technician program, and I also have an instructor here to share about that. So let me actually stop sharing to make sure she can share. Are you there, Ashley?
I am. Can you hear me?
Awesome, I can. Do you mind sharing a little bit about your program?
Sure will. So like Deanna said, I am the sole instructor for the pharmacy technician program here at Lord Fairfax. This is a career that is in very high demand, and the job outlook is only expected to grow, especially in light of the current situation that we're in. The program here currently at Lord Fairfax is 78 hours of instruction. Currently, we meet 2 nights a week, but that is flexible. Some of the topics that we cover in this course are, of course, pharmacy calculations. We talk about pharmacology, or the study of drugs and what they do in the body. We also talk about pharmacy operations and how prescriptions are interpreted and input to a computer system. And then we also talk about how to dispense medications, how to properly package them. We also cover non-sterile as well as sterile compounding. So regardless of whether you choose to go the hospital route or the community route, you'll be covered in both of those. And then we also talk a little bit about the laws regarding pharmacy as a profession. So what a technician actually does is assist the pharmacist. So you will be required to fill and dispense prescriptions. You will be able to interact with patients and other healthcare providers. You may be asked to take inventory of the different medications. And then there are also some specialized roles. To go into this field, I would suggest that you have appropriate communication skills, since you will be interacting with patients and other healthcare team members. You should be organized, detail-oriented, and strong in the science and basic math fields. The things that I love about this profession is that there's a lot of flexibility. So if you're a parent and you have limited hours and you might want to work the evening or the night shift, those hours are available. It also allows you to incorporate many of your interests. So if you like working with children, you may be interested in pediatrics. If you're more of an introvert, then you might like something like mail order pharmacy. If you're interested in laws and regulations, you might choose to work with a pharmaceutical company. Another thing about this field is that there are a lot of opportunities for growth, especially for technicians. There's lots of certifications that you can get besides your national certification. Another thing that's great about this program here at Lord Fairfax is that you will be eligible to sit for your national certification exam. Once you take that exam and you pass it successfully, you'll be able to go anywhere in the country and practice as a pharmacy technician. The last thing is this program does have a voluntary externship, but like Anna said, right now that's not an option. But if you would be interested in furthering your skills, then this may be an option for you. Okay. Did I miss anything, Anna?
I don't think so. I think you covered it all. Thank you so much.
You're welcome.
We just have a couple more things before we wrap up here, but I do like to mention that we have BLS CPR classes on campus. So if you're interested in that, there are a few programs that include it, but many of them don't because students come in sometimes with it. Also, some employers will pay for you to get it. So it is an additional class that is available to you if you would like it. We also offer ServSafe Food Protection Manager certification programs, as well as many online courses. If you are looking through our catalog this time, whether online or the hard copy, you will see several other online courses mixed in there, which we didn't highlight today, but I did want to make sure that I mentioned that we do have some available. Some of the last things that I want to mention is that we do have a lot of student handbooks and videos available to you. If you just go to our lfccworkforce.com/HNTK, which stands for Healthcare Need to Know. On that page, there's a bunch of videos, and again, all of our student handbooks are on there. If you, for some reason, registered for a class prior to June 1st, I strongly encourage you to go and check out the handbooks. We did just recently update them to make sure that we were covering everything that we needed to with all of the changes that have happened over the last few months within our classes. So I strongly encourage you to go and check that out. I will say also for a lot of our allied health care programs, computer and internet is required. And that's simply because we are utilizing Canvas as a platform for a lot of our things, including homework, sometimes tests, sometimes quizzes. Our hope is that we can offer all of these classes in person for the duration of the class. That is our hope. That is our heart. Our classes are hands-on. We enjoy that. We want to teach the skills, but in light of our current situation, we also realized that we had to be flexible. And so by putting our courses within the Canvas platform, it allows us to go online if we need to. If for some reason the governor comes out next week and says, sorry, you can't be in person anymore, then we have a platform to be able to do that. Again, our hope is that we will be able to continue in person. We've had in-person classes now for, we've completed some skills training for about the last 3 or 4 weeks. We've had some new classes that have just started that are meeting on campus. So our hope is that we'll be able to continue that way. But if not, we do have to flip to this online platform. So please be aware that if you're taking other classes through Lord Fairfax, this will also show up within your Canvas platform. And don't worry about it in terms of getting in there or fretting ahead of time. If you register for a class, we will certainly get you all of that information when it's time and when the class is about ready to start. I do also want to mention just briefly that our classes are filling up. Some have already filled. Unfortunately, we have had to cap some of our classes because of not knowing what the fall is going to hold. We did have to make them a little bit smaller than we normally do, so our classes are filling up faster than they normally do. So I would encourage you that if you have not registered for a class, please don't wait. Get in, get registered ahead of time or as soon as you possibly can. If a class is already full, I encourage you to get on the wait list. And you simply do that through the website. Instead of adding it to your course, it'll say add me to the wait list. Go through, set up your profile and get on there, because we do have occasions where students will decide suddenly it's not going to work for them right before a class will start. And what we do is we contact students and we go down that list, and Really and truly, the first one that answers, we go ahead and work with them first. So please know that if you get a call from us and you're on a wait list, please answer it, because we want to get as many students into the class as we possibly can. So with all of that said, I just want to say thank you so much for joining us tonight. I really hope that it was helpful, that it was informative. If you still have questions after this, we are here for you to answer those. You can either reach out to Janet or I. Our information is on the website. It is also in the catalog in the back. Our little mug shots are here, as well as contact information. If I don't know the answer, I can also reach out to an instructor. If you've got questions about financial aid, you can certainly reach us here at Workforce Solutions. You can come into the office. There is someone here Monday through Thursday, 8 to 5, and Friday from 8 to 4. You can give us a call. Currently, if you do call our number, it will be sent to basically an answering service. Leave a message, leave your contact information, and we will get back to you just as quickly as we can, usually within 24 hours. And or you can visit us on our website. Hopefully you've learned a lot today about navigating it and where you can find that information. So again, thank you so much for joining us. And I am going to go ahead and stop our sharing at this moment, as well as stop the recording. So thank you.